Hello, and welcome to Badger Talks Live, which brings exciting happenings, resources, and talent from your UW flagship campus to the people of Wisconsin and beyond. I'm Maria Morgan, originally from Delafield, Wisconsin. I'm a second-year Master of Public Health student at the University of Wisconsin School of Medicine and Public Health. It is my pleasure to introduce Deputy Director of the Master of Public Health Program, Barbara Duerst. Today, she will be talking about her work with students to help them comprehend the role of evidence in making efficient and effective decisions about health-related initiatives, programs, and policies that impact the way that people live, work, and play in healthy communities. She will highlight a data sharing dashboard project, mental health Navigator program, and innovative programs to address marijuana consumption and CBD use in Greene County, as well as health messaging and a program to decrease maternal smoking in Adams County. Barb began her education with a baccalaureate in nursing at Edgewood College, followed by a master's degree in community health nursing and administration at UW-Madison. After working as a Greene County public health nurse, Barb became a health officer at the health department. In her 11 years with the Office of Rural Health in the UW School of Medicine and Public Health, her focus was on providing access to quality healthcare to rural Wisconsinites and training students to work in rural areas. She also worked on family nutrition programming as a family living educator with University Extension. After 20 years of experience in public health, Barb joined the Master of Public Health program team in 2006. Please welcome Barb Duerst.
Well, thank you very much for having me on Badger Talk Live today. It's really an honor to be here. I'd like to spend a little time today talking to you about the class that I teach each fall, which is Public Health 780, Evidence-Based Decision Making. And this class is a class that's required for all Master of Public Health students in the MPH program at the School of Medicine and Public Health. I plan to give you a little bit about the history of the class, a brief synopsis about how the class runs, and then I'm going to highlight a few of the projects that my students have worked on through the UniverCity Alliance in both Greene County and Adams County. This fall, I'm also teaching the class in 2021, and my students are in the midst of working on projects in Marathon County and also in the city of Waunakee in Dane County. I began teaching evidence-based decision-making in 2016, but that's not to say that the course hasn't been part of the Master of Public Health program for many years. It was originally taught by Dr. Patrick Remington, who was the former Associate Dean for Public Health at the School of Medicine and Public Health. And as I said, it's been a requirement for all Master of Public Health students. Originally, it was called Public Health Principles and Practice, and it focused on the core functions of public health and the 10 essential services. And Pat is really an excellent teacher, and I learned a great deal from him over the years. And he was recently honored in 2019 with one of the Chancellor's Distinguished Teaching Awards. In 2012, Dr. Remington turned the reins over to Mark Edgar. And Dr. Edgar modified the course a little bit to focus on community health improvement process by taking students step by step through the process that Wisconsin health departments, local government, and health systems do regularly every 3 to 6 years. Dr. Edgar taught the course until 2016 when he left the university, and he was voted Instructor of the Year by the MPH students for 4 consecutive years each year that he taught the course. So as you can see, when I took over teaching the course in 2016, I really felt like I was standing on the shoulder of giants. So when I looked at the course, when I took it over, I really thought the course was incredible, but I really felt that there was something missing. Students walk through the community health improvement process by picking a Wisconsin community or county, by using data to identify an issue, identified an intervention, developed a plan and an evaluation, and they put it all in a paper and a presentation. But students often did this without ever speaking or interacting with anyone from the community that they were working on, or they never really stepped foot in that community to see what it was like or what it looked like. And I really felt that they were missing a really big piece of public health work, and that was engaging with the community. I knew from my real life experience as a health officer in Greene County in the health department that sometimes it really didn't matter how much epidemiological data was out there to share with the community. And because if people didn't feel that there was a problem or an issue or something that they could get behind and champion, that there just wasn't much of a chance of moving the needle forward or changing behaviors or changing outcomes for the population. A seminal text used in many public health programs across the country is Dr. Ross Brownson's Evidence-Based Public Health. An earlier edition of the book was used when the class first began in 2005, but eventually both instructors decided that they would move away from text in lieu of providing other kinds of resources for readings for the class. Dr. Brownson's premise is that our public health efforts face a lot of different challenges, and that often results in inefficiencies and ineffectiveness in public health programs and efforts. And part of that is that in Wisconsin and across the nation, our public health professionals are really overwhelmed and under-resourced. So Dr. Brownson says that some of the things that cause this inefficiency and ineffectiveness are choosing an intervention approach whose effectiveness is not established in the scientific literature, selecting a potentially effective program or policy, but only achieving a weak incomplete implementation or reach, so thereby failing to attain the objectives, conducting an inadequate or incorrect evaluation that results in a lack of generalizable knowledge or about the effectiveness of the program, or failing to show that the results or that there's success in the program to policymakers and people who make decisions about budgets, and then paying inadequate attention to adapting an intervention to the population or context of interest. And Brownson conjectures in his text that there's a strong need for evidence-based public health practice and healthcare delivery and teaching and learning. And that really resonated with me. As a former health officer and public health practitioner, I had seen some of these things firsthand at the community level. And I thought that if I could modify the course to include a service learning component, that I could really provide students with a more realistic experience, and that we could help public health coalitions and organizations and communities with their work to really bring some of the resources of the University of Wisconsin to bear on their projects. And that's really the Wisconsin idea and what we're really about here. So as my colleague and former Adams County health officer, Leah Eckstein, once told me, we as public health professionals really know about what is important when we develop programs. We know that it's important to base programs on evidence and that include a solid evaluation, but it's just that we don't always have the time and the resources to be able to do so. And that's really why I wanted to make the changes in the course to really be able to meet those two needs. So I chose to use the Brownson text, and his text includes the evidence-based public health framework. And that framework includes 7 elements. And those elements are assessing the community, quantifying the issue, developing a concise issue statement, searching and summarizing the scientific literature, developing and prioritizing program and policy options, conducting action planning and implementing programs or policies, and then evaluating the program or policy. So we go through each step of the framework in my class, and then students apply what they learn immediately on a real world public health issue or a problem. So here's how it works. Each June or July, I reach out to some of my former colleagues in public health, some alumni of the MPH program, because I've been around since 2006, and so we've had quite a few. And of course, the UniverCity Alliance. And we develop linkages with community organizations and entities that have already identified a public health issue through a community needs assessment. So we don't actually do that step in my class. That in order for us to work with the community, that already has to be done. I work with the community, the community organization, and they choose a liaison or liaisons that are going to work with me to really help to hone in on what the issue is, what they think they'd like to see as a result of that. And we have a discussion to see if what my students can offer them will meet their needs and whether the project seems like a good fit for my class. And then in addition, I talk to the liaisons, or we work it out so that they have, they're able to have enough time to meet with the students in my class on a regular basis throughout the fall semester. And we have the students, we expect the liaison or liaisons to meet about every 2 weeks, and that's done via distance. And then they also have to respond and read and review some of the assignments that the students have to do in my class. When September comes and our class starts, students complete a survey about their areas of interest. And then based on that survey, I put them into interprofessional groups of 3 to 4 students, and then I assign them to one of our projects. And in my class, I typically have about 50 students. So it's not unusual to have 15 or 16 projects going for each of my classes that is going on in the fall. The first thing that the students do in the fall when they start my class after they're assigned to their project is that they meet with their liaison, and they learn more about the community. They learn more about the project that they're working on and the issue that the community feels is happening. And they work together to develop a scope of work and a communication plan. And they hammer out the details, kind of negotiate back and forth, and reach consensus about how they're going to communicate, when and how much that they'll communicate about the project. And that's typically around assignments that are due. And the class is really based on what we call a scaffolding model. And so, as I said, the students learn about each of the elements as they're going through the process, and then they apply the evidence-based, they apply those principles to their community project. And then this often results in completing assignments, and then those assignments contribute to the final products in the course. And those final products are a paper or paper/proposal and a presentation. The final paper is presented in the form of a proposal that's loosely based on the Wisconsin Partnership Program's Community Collaboration Grants and the Community Catalyst Grant Program. While this has morphed over the years somewhat, there is also room for individuality in that format based on the community's needs. What the students really are doing now is really developing a final proposal that has 3 evidence-based methods that can address their issue or problem. And those initiatives then can be reviewed and chosen by the community to implement within their own time frame, and that can best, choosing the program or initiative that can best meet the community's needs. It can also be used, as I'm going to share in a few minutes, it can also be used as a grant proposal, or can be shared with other groups such as county boards or oversight boards and things like that. The students also complete a presentation that to the community, and that is to the community liaison, and then oftentimes the community coalition and other community members are invited to the presentation. Now, pre-COVID, I required our students to go out to the community and present the results directly in the community about what they'd done and what their end results were. But unfortunately, since the pandemic, we have had to have students present via Zoom for their safety and the community's safety during our regular class time during the last 2 weeks of the class. So for example, this year's presentations, all 16 of them, are going to be on December 2nd, 7th, 9th, and 14th. So if someone wants to come, just let me know. My course has the community-based learning designation through the Mordridge Center and through the University of Wisconsin. And I felt that this was really important to have this community-based designation to signal people who are taking the class outside of the students that are required, the MPH students that are required to take the course, but that it would signal students that it is a community-based learning class that includes service learning, so that if people were interested in doing some work like this related to public health, that they could join our class. My relationship with the university year began in the fall of 2017 when they were working with Dane County. My students in my class, I had one group of students that year that were working with that worked with Dane County and the UniverCity Alliance. And they did a really outstanding project for the Dane County Human Services Department on integrated human services data, improving service provision for the super utilizer population. So the super utilizer population would be clients that would be using a lot of services regularly that, you know, and maybe the different organizations within Dane County wouldn't know about each other. And so there was duplication and things like that. So that was a proposal to really look at how they could address that. And the student in this picture developed a poster for the end of the year celebration that University Year had put on. And she actually won an award for her poster that was based on the project that she did in my class. And it was at that celebration that I met Gavin Luter. And I guess, and the rest, as they say, is history. In 2018, UniverCity Alliance was working with Greene County, and Greene County is located about 30 miles south of Madison, and it's near the border of Illinois. And for my class, I literally hit the jackpot in 2018 because we had 9 projects to work with through the university year. And then we followed that up in 2019 with 8 projects. So you can see from this slide that the breadth and depth of public health projects ranging from breastfeeding to food insecurity to mental health kinds of issues to opioids to ACEs to transportation, all encompassing kind of all different areas of public health. So you can really see through this slide that public health is everywhere. Since the title of my talk is about outcomes, improving outcomes, and improving looking at the impact of my class, it's probably about time that I get into talking about what some of those are. And so I want to spend a little time talking about the Mental Health Navigator program that a group of my students did in 2018. And in 2018, a group worked on this proposal, and the idea was that a mental health navigator could connect clients with appropriate mental health and social resources, much like patient navigators who improve the effectiveness in the receipt of healthcare, in quality of life, in reducing disparities. And this is a standard way that patient navigation is done for cancer patients or for our senior patients. But there's evidence that navigators have been effective in improving health and quality of life in mental health care settings in both rural and urban areas. So students in my class developed a plan to implement a mental health navigator program that included goals and objectives and an evaluation plan. And as you can see from the photo, after my students completed their course and their work, personnel in Greene County took their proposal and fulfilled the proposal and took the plan and implemented it. And the program is called Mental Health Matters, and it's the Mental Health Navigator program that was designed by my students, and it's been in existence now since 2019. And here's just a screenshot of the project objectives that the students put together as part of the plan that went to Greene County at the end of my class, that they could easily, or maybe not so easily, but that they could implement. Another project from 2018 was the data sharing to combat the opioid crisis program. So around that time, human services, Greene County Human Services personnel, law enforcement, and judicial personnel had some concerns that they were missing out on opportunities to apply for grant funding to help address some of the issues that they were seeing in Greene County from the increasing opioid crisis and the epidemic that was growing. So by the time, what they were seeing is that by the time someone contacted everyone, all of these entities to collect data and get that data, they were missing the boat and they were not being able to apply for grant funding or apply for extramural funding that would help them to do some things. And they were too late, there were just many missed opportunities. So students in my class set about to explore some different options for creating a platform to share opioid related data, to offer a better understanding of the local epidemic and allow for better interorganizational collaboration to help develop programs and policies to improve outcomes and to allow the organizations to participate in grant opportunities in a really timely fashion. Through searching the literature and the evidence and to speaking to key players in Greene County at the local level, students were able to identify some key metrics that were to be included on the platform or dashboard. And the students' final report to the community included 57 plus pages that provided key information for consideration, including data sharing agreements, legal and regulatory consideration, organizational considerations, and considerations about security and more. And 57 plus pages is not what I require for my for the paper in my class. It's usually about 15 to 20 pages, so they really went above and beyond. So Bob Gibson from Greene County Human Services was able to secure a small grant to fund the students' recommendations from their opioid, from their paper that they did in my class or from the project that they did in my class. And the funding was used to fund this opioid dashboard that is fully operational. And if you look on your screen, this is what it looks like. This is a snapshot of Greene County's web page and entrance to the dashboard. The projects that we do in my class are not always really straightforward, and they're not always based on evidence that relates to a systematic review or a meta-analysis. Sometimes students have to really be creative in seeking out research and evidence. And the CBD use in Greene County in 2019 is one of those projects. This was based on a concern from the Greene County United Prevention Professionals for Youth, or GUPPIes. And the GUPPIes were concerned about the increased use of CBD oil in end products in Greene County. As we all know, CBD is sold in gas stations, convenience stores, hair salons, grocery stores, and it's included in food and beverage products. It's sold as supplements for pain relief, sleep, and general well-being for both humans and pets. So in this project, students researched evidence-based policy interventions that could address the need for safe use of CBD in a community. And so the students shared 3 strategies with the GUPPIes, and their strategies were to develop a local countywide ordinance to ban the sale of CBD-infused food and beverages, to develop and implement a risk education plan that included balanced information about the potential risks of CBD use in a community education campaign, and also the regulation of CBD product placement in stores and convenience stores and places like that. Another interesting project from 2019 that also wasn't based on systematic review or meta-analysis, but evidence, different kinds of evidence, just the same, came from the guppies and also law enforcement. And remember, this was a project done in the fall of 2019. In January 1st of 2020, the state of Illinois legalized marijuana. And since Greene County borders right on the Illinois border, people were really concerned about what the impact of legalization of marijuana in Illinois would have on Greene County residents. So a group of students in my class set out to kind of figure out what other states, what other border states had experienced when marijuana was legalized in places like, for example, Colorado. Could they draw some parallels to what Greene County might experience? And what they found through their evidence was that driving under the influence risks and risks to self and others often went up in border states. So they proposed two interventions for their project in my class. And they were to do a media campaign to reduce the risks of driving while impaired, that specifically targeted marijuana and drug use. And they also suggested the development of a screening brief intervention referral to treatment, or espert program. And espert is a program that emergency departments and primary care organizations can use as patients come in to be seen with issues, drug-related issues, or marijuana-related issues. And what it entails is a 5 to 15 minute motivational interviewing intervention. And then based on that intervention, that motivational interviewing, the patients can be referred to the care team if needed. And espert is an evidence-based program that has one of the pioneers of that program used to be at the University of Wisconsin-Madison in the Department of Family and Medicine, and that was Rich Brown. The students presented to the guppies in December of 2019, and then, of course, as we all know, early in the spring of 2020, we were all hit by the pandemic. And so while these are really promising interventions that could be pursued by guppies and the law enforcement and other groups in Greene County, to my knowledge, they haven't been implemented at this time, but they're promising sort of interventions that could have a big impact. I want to switch gears a little bit and focus on the work that the students did in Adams County through University Year in the fall of 2020. In the fall of 2020, we had 12 projects last fall within Adams County, and they focused again on a variety of topic areas that you can see here. Those included the culture of health, health messaging, raising awareness about health equity. There were several school-based projects and a few AODA and tobacco-related topics. One project that I want to highlight is the health messaging product, and that was completed by Maria Morgan, who was the person that introduced me today, and her group. When we first started talking to Adams County, they really wanted to have a situation where they were doing good health messaging and really wanting to make the right points and make the right messages so that it helped to better the health outcomes for the people in their population. And the students thought about it a lot and talked a lot to the leaders in that program. And what they really came up with was, rather than kind of creating several health messages that could be put on the shelf that the students could use later, that what they really wanted to do was to identify a set of frameworks that could be easily used by the Health and Human Services personnel to craft appropriate health messaging for various populations and subpopulations. So the project they developed was, very different from what typically happens in my course, where it's a proposal and there are 3 potential options that the community can pick from. This project that they developed was really kind of a how-to manual for the community. And it's really comprehensive and it's very user-friendly. Maria and her team did such an excellent job, and the community members were really very happy to begin to use it. And as I said, it's not the format that we typically do in my class, but one of the points that I try to make in my class is that it's really important to be able to be flexible and nimble and to meet the unique needs of the community. And this was certainly a unique need of the community. And I'm certain that Adams County Health and Human Services has been using this, especially when there's so many health messages that they needed to craft during our COVID situation that we've had across the country and across the state, when they're sharing health messaging about the importance of vaccines and masking and other important guidelines. And this guide will be able to be used much more broadly into the future. Another interesting project from the fall of 2020 was a school-based primary clinics project. The health department and the Adams Friendship School District are really interested in developing some kind of a school-based clinic. And our students were able to identify 3 different kinds of models that the school might consider implementing. And so the post 780, after the class was over and they presented these 3 models, one of the students signed on to continue to assist the school nurse and the health department personnel in furthering their plans to implement one of those models. And the student is doing this work as part of her required applied practice experience. So I could literally talk for hours on the great work that the MPH students in my class have done on these projects. Well, sometimes, in government and bureaucracy, things move a little bit slow. Each and every one of these projects gives the community organization something that they can think about and strive towards and implement on their own time frames. Some of the programs, projects that were presented to the communities have been implemented, relatively quickly. Some have been partially implemented, some have been considered, and some have fallen by the wayside for now. But it's really given some great food for thought and some really great projects that really have made an impact throughout the state of Wisconsin. I want to just thank the University Year Alliance for their partnership with me. I really want to call out a heartfelt thank you to Gavin Luter, who's been so great to work with, and he's really helped me take my class to a different level, a higher level actually. And I just love his enthusiasm, and he's just really fun to work with. And I also want to thank Kelly Conforti-Rip, who was part of the University Year the first few years I worked with them. And she's no longer with them, but I also want to shout out and say thank you to Shelley Strom, who I'm working with now. I want to thank my community partners in Greene County, Kara Carper, Roanne Warden, and Bob Gibson, and the partners in Adams County that I worked with a lot, Leah Eckstein and Kelly Olson. And I can't say enough about the great students that I've had in my class. The huge shout out to them from the fall of 2018, 2019, and 2020. These students really get into these projects, and many of them, one of the examples I gave, many of them go just above and beyond, and just to really make these projects and interventions adaptable and usable for the communities that they're working with. And let me tell you, I've had to almost stop a few students from going to the communities and moving in and trying to implement some of these things themselves. And then finally, I just want to say thank you to my teaching assistants for those years. The projects wouldn't have been as high quality without their assistance and their work. And that's Samantha Azen, Kelly Hackett, and Mary Kate O'Leary. So again, I want to thank you for the opportunity to share my passion and my work with you today. I hope that you can see from the highlights that I shared that public health is everywhere in our lives. And thank you again, and I'm really happy to answer any questions that you might have.
Barb, you have just blown me away. I know when Gavin reached out and we were talking about showcasing some of the work, I know that UniverCity Alliance has numerous projects happening. I just didn't realize that 15 to 16 a semester were coming through you and your program. I'm not sure exactly when you sleep at night, but
I don't.
Well, congratulations. And boy, this is the epitome of the Wisconsin idea in action. And I know you gave a shout out to UniverCity Alliance. They did post here on the chat that we're so thankful for your partnership, Barb. Our communities have benefited so much from your passion, your class, and your students. So I'm sure the feeling is very mutual. If anybody would like to reach out to the UniverCity Year program, you can email Gavin Luter, the director of the program, at gavin@cows.org. Hello, everybody. Fran Paleo-Moyer, Badger Talks producer. We're talking with Barb Duerst today about the Master of Public Health program and the impact that these students are making. We do have a question posted by David Wan, and not sure that this is directly something you can speak to, but your opinion on this would be appreciated. So what could we be doing to get more faculty to teach these community-based learning courses?
That's a really good question. I think that you have to have a strong passion for working with the community. I think that some of my students sometimes find out during the time that they're working with communities that it's not always, things don't always go as planned. And so I think that you have to be willing to be flexible and to kind of sometimes go with the flow and change things midstream. But I think that the University of Wisconsin-Madison has some really great resources that I have used countless times, and that's really supported me in putting together a class like this. And those include working with the UniverCity Year Alliance. That's been really helpful. There's a lot of, there's great support there. Meetings, getting other professors together that are teaching similar classes to kind of to troubleshoot and talk about these kinds of things. And then also the Morgridge Center has really great resources with their community-based learning program. They have, just really wonderful, community engagement resources for students to help students learn about this. They have really great support systems and groups that you can participate in to share tips and resources and things like that. And they even have the Morgridge Center even has some grant funding to help faculty get started with some of these courses, with setting up courses like that and kind of getting their feet wet. So there are some really nice resources that really help at this university.
Can you talk a little bit about some of that interdisciplinary work? So for example, maybe a community that your students are working within also has maybe like a communications plan that's being done. Are your students working with other students and other departments as well? Or is that more of a side-by-side kind of role?
A lot of times it's side-by-side. I think ideally it would be really nice if we could do that. But sometimes the scheduling just doesn't work out. And it just is really hard. All of our students, whether it be from undergrad classes and communication classes and public health classes, they all have busy lives, and trying to schedule and match those things up has been really difficult. I think it's really worth trying. They're usually aware of what the other is doing, but in my class anyway, it's been happening more in a parallel fashion, but something to strive for, certainly.
I know you did mention this one student who continued on after the project was done. Are you seeing some of that where these students go on to work in the communities where they're engaging with these projects or maybe similar communities?
Yes, I think that is a really great thing. So one of the things in the Master of Public Health program, for sure, students are required to do something called an applied practice experience, which is really like an internship. And so they have to do 240 hours. And some of the students just get so into the projects that they're doing in the 780 class that I teach that they want to continue to work with the community. And that's just a really great opportunity for them to continue on and take it to the next step or take it to the next level. So we have had some of that. We've also had some students in my class that have heard about another project that other students were working on, and they got on board and started working in that class too. So
Cool.
It's been exciting. I don't think at this point we've had anyone that actually got hired by one of the community or organizations that we work with, but I think that's always a possibility because I think health departments and community organizations are aging out and looking for new people, and so hopefully the talent and the experiences that students have in the community will make them be excited about working in some of these organizations too.
I know this is probably a question that Gavin could address from the Alliance, but also if I was a county administrator, say, in Dodge County or a county up north, and I wanted to be considered for participation, is that something you're filtering all through UniverCity Alliance, or would they reach out to you as well?
So I think when the students are, or when Gavin is working with them, or the UniverCity Alliance is working with the county, oftentimes the county reaches out to Gavin about, that they have potential projects, but entities can also reach out directly to me. So I hear from different organizations and, throughout the state, and often since I need 15 projects every year, I don't, often don't have enough just through the University Year Alliance. So I have to seek other ones too. So it is nice to hear. I often, when I go to the Wisconsin Public Health Association annual meetings, I put a sign out if anyone's interested in working with the students. So we're always looking for great projects for students where they can engage and learn from the community organization.
Would you mind just for our audiences, just sharing your email address quickly?
Oh yes, it's Barbara.Duerst, and my last name is spelled Duerst at wisc.edu. So Barbara.Duerst@wisc.edu.
Great, and I'll throw that in the chat also.
Oh, thank you.
Yeah, well, Barb, thanks so much for sharing this great work. We're really lucky here at Badger Talks Live. I know Anthony and I, after talks, were always just like, man, didn't know that was happening. We're always blown away by the great work being done on campus, and this is another great example. So thanks so much for joining us today.
Thank you so much for having me. It's been really fun. So thank you.
Great. Well, we're going to continue shedding light on this fantastic UniverCity Alliance program, and we're going to be on Tuesday, November 30th at noon. So in 2 weeks, we're going to be talking with Jessie Conaway, who's a faculty associate for the Native Nations Partnerships with the Nelson Institute on the UW-Madison campus. And she's going to have some special guests with her from the Ho-Chunk Nation, who will be talking about special projects that are being completed with the village of Wanakee here in Dane County. So please tune in. Visit us at badgertalks.wisc.edu. You can sign up for our email list so you can hear about all of these great upcoming talks and not miss anything. You can also sign up for our email list there, consider a donation to Badger Talks, and then you can search a roster of over 400 UW faculty and staff that have signed up to give talks around the state in communities like yours. So please check out that resource. Also, check out the Badger Talks podcast with Ben Rush, and Barb is our most recent podcast that we've featured. So please go out there and check that out as well. Thanks so much for tuning in, and we'll see you in a couple of weeks. you.